people in rural America, they work hard, they're proud, they're strong, and they want to have a fair shake. They can't get that without internet access.
Hello, one and all, and welcome back to a brand new episode of The Rural Impact. I'm Michelle Rathman, and I mean it when I always say this because I do mean it. Thank you for joining us for another conversation that aims to connect the dots between policy and rural everything, at least everything rural we can think of. All right, so speaking of connecting dots and connectivity, on today's show, we are going to cover the subject of rural broadband and coverage challenges and the impact that this has on the delivery of safe, high-quality healthcare. And of course, there are many angles to this story, but we're covering this for a reason, and you'll understand why in just a moment. You know, as we know, during the COVID-19 pandemic, rural broadband challenges, although they existed before, really rose to the top on the national stage, and we really got a glimpse of how challenging it is for rural broadband to reach so many rural places and the implications that it was not just for healthcare, but on students, for example. And we also know as a result of that, there were several calls to action to address these disparities. However, we know that these issues continue to persist, and threats to funding today that aims to close the digital divide in rural places across the U.S. Now, this is threatening another threat to rural America, and losing that those grants is going to be very significant. And, you know, even though our legislators know this, that internet connectivity, particularly access to broadband, is playing an increasingly important role in both healthcare and public health and local economies. And so it's important that we make sure that this conversation reaches the legislators who are making decisions about whether or not this funding should continue. And, you know, we also know that it's revolutionizing the delivery of care. So as we're talking about a healthier America, it's important for us to be honest about the fact that without connectivity, the delivery of telehealth, for example, is just not possible. So it's a very complex issue. And even though there's been, I think by my count, about $100 billion that has been allocated to fix the broadband inequity issues in rural America, over 130 programs that are being administered by 15 some odd agencies, we still have not arrived at sustainability of connectivity and solutions for all. So to help sort through all of it, I'm no expert. I've invited the experts to come to the table. First, I will tell you that we've invited Joshua Seidemann, VP of Policy and Industry Innovation at NTCA, and that is the Rural Broadband Association, to break some things down for us. But first, you are going to hear from two very special guests, and they're incredibly important investigative reporting focused on rural dead zones, which are, of course, areas across rural America where hospitals and patients have no connectivity. In fact, disconnected from modern care because of not having high speed and affordable internet access. So in their series Dead Zones, KFF Health News reporter Jane Tribble and Caresse Jackman from InvestigateTV, they cover this subject in great detail. And they are going to share with us their investigative work about places where people live and doctors don't practice and telehealth does not reach. And with that said, I am glad that you have the bandwidth and the broadband to join us for this conversation today. So with that, I invite you to tune out that background noise and put yourself in that podcast listening frame of mind and listen to my conversations with Jane Tribble, Caresse Jackman, and Joshua Seidemann. Are you ready? You know I always am. So let's go. Oh my goodness, Jane Tribble, Caresse Jackman, thank you both for joining us. It's going to be an excellent conversation because it is an issue that impacts so many people. One rural community is too many, in my opinion. So I'm grateful that you are here. I've done a little tee up for listeners to understand what this is about. So Jane, I'm going to have you dive right in. But first, I'm just going to put this out there because on September 4th of 2020, you wrote a piece with the headline that read, HHS plan to improve rural health focuses on better broadband telehealth services. That was about 1 million years ago, I think, maybe 5. And today, so many people are still living without internet connectivity. It's nothing new to so many rural communities. And you have decided to take that and turn it into something really important and a series. And I'd like for you to just kick off the conversation by talking about the project, what it's about, why you're doing it, and then we'll dive deeper in.
Michelle, thank you so much. And yeah, that seems like a different lifetime ago, 2020, doesn't it?
Mm-hmm.
So back in 2020, I was on, in KFF Health News, working on Capitol Hill and writing stories. And I was seeing a lot about telehealth. I think we all heard a lot about telehealth during the pandemic. It became a household word. We learned about kids sitting outside McDonald's, not being able to do schoolwork. And I began to wonder, what does that mean for rural areas who need healthcare and can't access telehealth? So that was sort of the start of this idea, knowing that the federal lawmakers are talking a lot about supporting telehealth. And look, every administration has in some way supported broadband infrastructure. In other words, said, we need to increase high-speed internet across the U.S., whether it be the Obama, the Biden administration, the Trump administration. They've all made their efforts towards increasing infrastructure for rural America. And I know we're on the Rural Impact podcast, so I'm focusing on that. Mm-hmm. Of course, there's access problems in urban areas too. But I was very curious about telehealth and would it work in rural America without the broadband access? So that was the origination of the idea. And I pitched to the editors at KFF Health News this idea of looking at where people in rural America could actually access telehealth and where they couldn't. And my editor, Nathan Payne, came up with the idea of mapping the counties across the U.S. So what we did is we took FCC broadband data, the latest, and that took a little bit of a trial and error to figure out what was good there.
Right.
As I'm sure your listeners are aware. And then we overlaid that with primary care and behavioral health care numbers, deserts, if you will, and found more than 200 counties, mostly rural across the U.S., that lack kind of a high level of any three of those things, so all three of those things of high-speed internet, primary care providers, or behavioral health care providers. So that's sort of the gist of the project.
And a recipe for the stories that you told, the outcomes that we're seeing as a result. Real quick, we're going to get into this a little bit later, but the map is, I love maps. We just had on Ben Spohr that talked about, kind of congressional health districts and so forth. I love how you overlay the data. And I think it's important, again, for us to connect the dots because there was funds that were allocated to this. I think the number was like almost $42 billion.
$42.45 billion.
Allocated to it. And so I take a look at, I don't print out the whole thing, but I take a look at the state. One of the states that you focused on was Alabama. And the stories that came from Alabama, and I see over $1 billion. And I know there's some back and forth about it. Sarah, Jane, before we move on, just a little bit about where we are with the funding that was allocated. Can you expand a little bit about what's happening to actually make projects happen, shovel ready in the ground? My understanding is that there's not a whole lot happening right now.
Right. Well, first, let me give you a little bit of context that Caresse and I have both talked about and reported about. And then I'll give you the latest news because I was just on the phone yesterday interviewing somebody from, recently who left the administration. And so the context is, over the years, so many different administrations have acknowledged the challenge, particularly in rural America, for building infrastructure. When you talk to experts, you often hear this sort of comparison to rural electrification. You can't get it done in rural areas unless you have federal support. What's happened is a hodgepodge of 133 different programs across 15 different agencies at last count by the GAO, the Government Accountability Office, and billions of dollars. I asked one expert in DC if they had a number of how many billions of dollars in the last few decades have been spent. They sort of laughed because it's so hard to get to a number because there's so many different programs. And as you'll recall, during COVID, there were billions of dollars spent on different kinds of infrastructure projects. Some of that was pulled for broadband internet in different places. In fact, some of it's still being built out in different places with middle mile projects and capital fund projects. So the context of the latest grant, if you will, the Broadband Equity Access and Deployment Act, is after all those other programs have occurred. And so in 2021, Biden signed the infrastructure law, which included the SPEED Act, the $42.45 billion roughly. It also included money for the ACP, the program that gave, subsidies to low-income households across the U.S. and some other programs like the Digital Equity Act. So it was supposed to be a package that really delivered internet for all. That is the tag word that the Biden-Harris administration had. fast forward a few years, right? In 2025, the Trump administration comes in and knowing, as we do, because we just opened this episode with it, that Trump, announced that he was going to help fix, access in rural America. Knowing he cares about this, we might be a little bit surprised now to see that the administration has announced that they want to do a rigorous review of the program and really question where the money is being spent and why it took so long for that program to be in place. And from what I'm hearing right now, everything is a little bit on hold. States that were supposed to get money to start hiring internet companies, ISPs to deploy, haven't gotten that money yet. So that's where we stand right now.
So a big fat question marks all over the board, and not just this funding, but so many other things that are connected to it. Caresse, I want to talk to you a little bit as well, because the data that Sarah Jane is talking about, the maps, the shortages, I wish we could be having a conversation that talks about the solutions and about how these lives are changing for the better. But at the end of the day, you had time to spend with those who are impacted directly, their health, their quality of living, their access to healthcare as a result of not being connected. So for those of our listeners who have not read or watched these stories, I encourage you to. We're going to make sure we have the links, but give us a little bit about what your takeaways, Caresse, and about the stories that you heard and the impact that you hope that the storytelling, their experiences will make on those who have the ability to make change happen.
Right. And I just want to say it has just been an honor for InvestigateTV Great Me to partner with KFF Health News and Sarah Jane Tribble, Holly Hacker, who handled the data aspect of this, because it's such a great partnership. They did an amazing work with the data in the article, and we wanted to bring it to life visually. So thanks to Sarah, we were able to travel down to Alabama and go to some of these areas and interview some of these sources. And what I found amazing was how humble these people are, despite the issues that they face, despite the challenges that happen and many of the chronic illnesses that they're facing right now. And I remember thinking after those interviews, okay, I want to hold on to that emotion that I felt and bring it to life visually. So we sat down with Barbara and looked through her pills and had her bring out her internet connection. We sat down with Leroy Walker, who is battling kidney failure. And I just remember feeling the pride that they felt, saying, I live in the country. I don't want to move anywhere else. This is home, but I want the same broadband access as everyone else in the country. And that's what struck me. And as somebody like Leroy, my dad didn't grow up in the country, but he battled kidney failure. So even after speaking with Leroy Walker, who's on dialysis, it was very emotional for me. I left there and I teared up, and I had to take a minute before I went back and listened to the interview, because I felt for him. And that's what I wanted people, regardless of if you live in a rural area or urban area or a semi-rural area, I wanted people to take that away visually. And then I worked with Owen Horstein, call him Chip, on our team. He's amazing at bringing a cinematography type editing to life.
I'll say.
Yes, he's tremendous. I have to give him his flowers. And we just talked back and forth all throughout the time we were editing. Like, how does that work? Should we put a line in here to bridge the connection? Mm-hmm. And bringing that map to life visually was amazing. And so all around, it's just a great partnership.
And I was also struck by hearing from a health CEO, a leader of a healthcare organization down in that area. And what really struck me is, brand new hospital, brand new. And Sarah Jane, you also did a piece about how rare it is for a community. Some buck the system, but how rare it is for a community to be able to bring their hospital back. But what struck me is, the full context of that is that a brand new hospital is built, and is there an inference then that it's closed because it didn't have the connectivity? There's no way to run a hospital today unless they're not meant to be field hospitals. Right. They need to be fully equipped to deliver quality care. And that, to me, Sarah Jane, was another kind of glaring, what are we doing here moment for me.
Yeah, I think the thing that strikes one once they go out to these communities is, one, the thing Caresse just said, they know what they don't have, right? Like, we don't live in an insular world anymore, and we haven't for decades. So when you go to these communities, they understand that other cities have better access. They understand that there are patient portals people can log on to, and they don't have access to log into a portal, check their labs, or, call into the doctor's office and get a video call instead of driving 45 minutes or, waiting 3 months for the specialist. They don't have any of those things. They know they exist. They don't have them. So that's number one. Number two, what's striking is if you visit these hospitals, and I did a look at some of the federal funding mechanisms that provide grants to hospitals and extra funding to hospitals for internet access, because there has been support on the back end for that. And what you see is hospitals in rural America across the U.S. that lack fast enough internet, right? And I say that because part of the challenge has been defining the standards of what high-speed internet is at a federal level that then requires internet service providers to meet those standards. So if you say the standard is this level, then, your internet service provider, look at your bill. It says up to, you're going to get up to that amount. Well, if you're a hospital that needs a central monitoring system, electronic health records and scans to move to other regional hospitals that can take care of the patients you're transferring, well, that up to needs to be pretty darn high to meet all those needs. A lot of places in rural America.
You did a speed test, right? You did a speed test in one of them, and it was pitiful. I mean, most people. And so I think it's a really good segue because I've got the map in front of me. And Sarah Jane, would you mind just kind of walking through? So you've got, not just dead zones, but there's varying degrees of connectivity issues that can be found in the map. So there's the absolute, what we would give a big fat F to failure. So talk a little bit about kind of the rurality of those different zones.
Yeah. And so the hypothesis I went into this with was that rural areas were more likely to be lacking broadband access, the infrastructure access. And what you're seeing on the map, and I don't have it in front of me, so forgive me if but what you're seeing on the map is that a certain percentage of the homes are meeting the current federal standard, minimum standard of 100 megabits per second over 20 megabits per second. You and I are probably using a lot more of that right now, but it's kind of the baseline that a household can need, a household of four can use for like gaming and getting on the internet and so forth and accessing like banking services. We talked to experts across the U.S. and what you're seeing on the counties is the percentage of houses that have that high-speed internet access. And I'll tell you, when I first started this reporting in Greene County, Alabama, where Leroy Walker and Barbara Williams live, when I first started, only 6% of the homes had federal standard of high-speed internet. Now I went back, almost a year later, if my date's correct, and at least 6 months later. And it was more like 50% of the homes, still well below the average county in the US. So they still are in what we define as a dead zone. But that's because federal grants from ARPA and the COVID money had finally started having built out in the area. And so you're seeing the build out. The hospital itself, though, in Greene County is still waiting because the building mechanism, the funding mechanism for that hasn't reached them yet.
Will it reach them?
They've been told, and I've talked to the companies, they have a deadline where they have to meet it, and the companies say they're going to meet it. And that will be early next year.
So you both done a lot of research on this. You've released 2 really comprehensive pieces. Sarah, Jane, you've been doing this for a while. I think about the other disparities that you're able to expose through this. I mean, Caresse, the patients, the individuals, the brave, courageous individuals who share their experiences, they are dealing with, chronic illness, and the connectivity piece is just one big piece to it. So is there either one of you could shed some light on maybe some other things that you uncovered where, these all intersect? I know the focus has been on the connectivity, but what else have you discovered or gleaned from this experience?
Well, one thing I discovered too is just not only are we talking about people with chronic illnesses, but also the fact that they are stuck in many times food deserts, right? And food insecurities. When we were there, we were interviewing Barbara Williams and Mayor Hattie Samuels. We said, hey, well, we're going to grab a bite to eat. And even Sarah told me that before we went down. And they said, well, there's that one cafe that's closed, but you can stop at the gas station if you like. And it really hit me like there's not only is there a lack of broadband access, but you look at food insecurities that can continue to allow some of these chronic illnesses to fester in these communities. And that was the sad part to me. It's, we ended up going to the gas station, grabbing some food, but you have this correlation again. You have this intersection of lack of internet access, healthcare opportunities, a lack of healthy foods. So you have this vicious cycle that continues to go on. And it's heartbreaking that even just things that you take for granted in urban communities, that it's just not there in our rural areas where our family and friends are. And that also struck me. So when we were getting images of the town, I made sure I said, hey, please make sure that you get that closed cafe for the day. Please make sure you get these areas, because that's the reality that so many people face. It's all intertwined. And that's what struck me out. So when I was out there.
It's challenging. I heard the leaders from the healthcare organization say, what's the solution? Money. We need money. And Sarah Jane, I wonder if you have any insight into, I hear about the hospital closing. I mean, the cost, the economic impact, the cost to the communities that then will lose their hospitals because they don't have because they're in a dead zone. It makes no sense to me whatsoever.
Yeah. Let me just go back to one thing that we were talking about previously, and that is in our stories, we just to sort of emphasize your point on social disparities. We're not saying the internet caused these social disparities. What's happening is the internet isn't helping places that desperately need it, that we know as a society have been left behind for years. So these are places with higher stroke incidences, higher diabetes, higher obesity incidences, higher blood pressure higher problems with heart disease. If you look at the map, you can go to each county and see some of those instances. And we have a downloadable database that you can do the spreadsheet. So just sort of to say, we're not saying it's causation, but it's definitely, they're correlated. And these are places just have been left behind for decades now. So that's one thing. And when you talk about the hospital closures, Michelle, I think your audience probably knows I've written a lot about rural hospital closures over the last 4 or 5 years. And the Thomasville Hospital in Alabama did close after it was reopened. The Greene County Hospital in Alabama is still open, but it struggles to stay open. They lost revenue on serving patients in their last cost report, like many rural hospitals. So this is just building on top of the challenges they have. If you don't have a fast internet connection for your hospital, it just makes it more challenging to get the right staff to come in, right? Because that staff has to do double time to do the work. So it just compounds the problems that compound upon themselves. I think you asked me about the money. And right now in DC, I've been told you don't ask for money right now. That's not the conversation we're doing in DC right now.
Yeah, absolutely. And it's why it's so important, which doesn't mean that we can't talk about it, because the need is going to be there. The gaps are going to grow wider. There's no way around it. Before we close out, and I just want to say that was an excellent point about what you just shared. And I want to just go on that and say hospitals want to deliver really high quality, safe care.
They do.
And without that technology, it makes it really difficult, not for will, not for want, but because they don't have the resources. So I think that's an important point to make. Okay, from you both, I'm sure this isn't it. There's more to say on this conversation. What can we tease? What do you got? What do you have going on? What can we expect to see next?
Caresse, I'll let you take that one.
All right. Well, there is another installment coming up soon. And this time we traveled West Virginia and we spoke with family members there. People there who are battling that inner fight with trying to get broadband access and what happens to the funding when it comes to building broadband and the challenges that they face. So the work continues. We headed to another state to really hit home. And Sarah and I both actually traveled there together recently to talk to people and to interview people who are in Appalachia and are dealing with these problems every single day. So we wanted to show that it's nationwide, and that's what we did, and we're committed to it. So Sarah, I'll also have you take over.
Yeah, I think the biggest goal, and what I love with working with Caresse about is, we understand that the people in rural America are no different than people elsewhere. They have the same wants, hopes, desires. You want good internet access. They're not caricatures of, any one thing. People in rural America, they work hard, they're proud, they're strong, and they want to have a fair shake. They can't get that without internet access.
And it shouldn't be about volume, really. I mean, that's kind of the essence of this. It shouldn't be because the multipliers, but this makes a difference for one community, one hospital, one family. Thank you to you both so much. We welcome you back anytime because we want to hear about your road trip. I could be your groupie. I could go in the back seat of your car. Nobody wants that. But listen, for the rest of you, don't go anywhere. Again, we'll be making sure the links of the conversation that we had and the resources and the great data map that we talked about and the YouTube videos that you can watch. But this conversation is going to continue. But first, I'm going to ask you to sit back and listen to a very important message from our partners at the American Heart Association. For rural health leaders, this one is very important for you to join in on this conversation. We'll be right back. This episode of the Rural Impact Podcast is sponsored by the American Heart Association. The American Heart Association believes that everyone, no matter where they live, deserves access to high-quality care. That's why they created the Rural Healthcare Outcomes Accelerator, a program designed to help rural hospitals improve cardiovascular care and patient outcomes. The Rural Accelerator provides no-cost access to quality improvement programs, data-driven insights, learning collaboratives, recognition opportunities, and expert-guided education to support 1,000 rural hospitals across the country in delivering evidence-based care. Now, there's still room, so rural hospitals play a critical role in their communities. Enroll today and join the movement to improve rural heart health. To do that, just visit www.heart.org/Rural Accelerator. Again, that's heart.org/Rural Accelerator, and you can learn more. Now, let's rejoin our dot connecting conversation. Hey, Joshua Seidemann, VP of Policy and Industry Innovation at NTCA, which is the Rural Broadband Association. We welcome you to the Rural Impact. We're really happy to have you join us this morning. Thank you.
Thank you for having me.
Okay, Josh, before our break, our listeners heard a conversation that I had between Jane Tribble from KFF Health News, who's on the rural beat, and Caresse Jackman with InvestigateTV. And we were discussing their really wide-ranging, in-depth reporting in a series that they're doing called Dead Zones. And these, of course, are areas across rural America, other places too, but the focus is rural America, where hospitals and patients are quite literally disconnected from modern care because of not having high-speed internet that so many of us take for granted. I know that I do most of the time. So I thought, what better way to kind of round off this episode than hearing directly from an organization that's representing, as I understand it, about 850 independent, family-owned, and community-based telecommunications companies working to build and deliver broadband connectivity. So, Josh, let's just get started by covering this challenge. Why in the year 2025 in the United States of America are rural communities still in dead zones? What say you?
Location. A lot of it depends on population density and the per user cost for getting the network out there. In urban areas of the United States, the population density is about 2,500 people per square mile. In rural areas of the United States, the population density is about 19 people per square mile. Mm-hmm. And in NTCA member service areas, the population density is about 9 people per square mile. So if you're thinking about a capital-intensive network, mm-hmm. the more people who are using that network in a square mile or on a linear road mile, the lower the cost per user. So I'll throw out some numbers at you. Mm-hmm. Your electronics per location to provide broadband is about $700 to $1,000. Not a huge amount. In a rural area where a house has a long driveway, figure $1,000 to $2,000 to get from the main line up to the house itself. Again, not terrible. But when you're talking about deploying broadband, that's going to depend on the type of soil in the area, access to poles. If you're doing aerial construction, if you're trenching, then it's going to be the existence of other utilities, the availability of contractors. So mm-hmm. once you're talking about the mainline construction, it can be $20,000 to $60,000 per mile. So Now we're going to talk why we have some dead zones.
That's right.
As you mentioned, NTCA member companies are locally operated, either family owned or community cooperatives. Our members are currently reaching more than 88% of their locations to fiber to the prem.
Okay.
Because they're locally operated companies. If you are a publicly traded company, you really need to make the case to your shareholders. And there's a difference between shareholder incentives and sociological incentives. And for a large publicly traded company, it's a difficult business case to make to pour that sort of investment into a small community. So I think that's where you begin to see the difference in deployment levels between companies that are served by large national scope firms and areas that are served by locally operated cooperatives or family-owned businesses.
So in the absence, I mean, let's just say it out loud, it's the math. And the math doesn't work in so many cases. It's not for lack of will or wanting to. The investments are important, and so much so that that's why grant funding and, those are some of the things, and subsidies are so darned important to make sure that we close those gaps. And I wanted to mention to you, we just talked a little bit before we started here that we know, I read a piece this morning that says that, of course, in addition to dead zones, we have other digital divides, if you will, other challenges. And they were being addressed, we're still not certain what's going to happen here, but through the bipartisan policy, the Infrastructure Act. And on May 8th, President Trump said that the government would be ending digital equity grant funding, which is funding, as I said, made possible by the Digital Equity Act, attached to the bipartisan infrastructure bill, calling it a giveaway. And, there were a lot of shovel-ready projects on the ground and so forth. So at the end of the day, what do you anticipate happening without this already promised money? But in the future, where do we go if we don't have these federal dollars? What can we say to those, those hospitals, those communities who are relying heavily on support where they don't have the funding to support this? Their municipalities, their counties don't have the funding to make up for simply what's not there.
Right. It's a great question. It's a difficult question. There's certainly an air of uncertainty over certain aspects. On the bright side, NTCA has a program, and I think maybe we'll chat about it later, called Smart Rural Community.
Yeah.
We produced a paper a few years ago that looked at digital engagement in rural spaces, and we did comparisons of national statistics and findings in terms of adoption and usage rates. And what we found to be remarkable, and we pulled numbers from a variety of sources, is that the gaps in broadband adoption and digital engagement are closing over time. And we looked at numbers based on age, sex, race, these major demographic categories, and all those gaps that we saw in the first years of broadband becoming popular are slowly closing, and they're getting to the point where we're not seeing the gaps. The remaining gaps we see are related to household income and educational attainment. And they're related because household income is correlated to educational attainment. So when we talk about broadband engagement, the single biggest factor holding people back is affordability. So,
and that was perfectly illuminated in the dead zone story as well, because what we also looked at, of course, if you read the piece, the first that have come out, is that those dead zones also overlap with health profession shortage areas as well. And so it's just like this double, triple whammy for these communities, in particular, highlighting those in Alabama. I do want to talk about these other programs. Before we go there, though, I know that, from a federal policy standpoint, you all are, in front of the Supreme Court. You've been very active in USF and the Supreme Court fight about ending some of that programming, which of course it's a fund that enables broadband deployment in rural and implications for upholding the Fifth Circuit Court in New Orleans. I mean, where are we going to go from here? Talk a little bit about that for those who don't understand the background. This is really important.
Sure. So Universal Service Fund is a program that is administered. It's overseen by the Federal Communications Commission.
Mm-hmm.
The nuts and bolts of it are administered by a private company called the Universal Service Administrative Company. And money is collected based on assessments to providers of interstate telecommunication services, which sounds a different mix of between Latin and Greek, but essentially, it is any telecommunication service like a telephone call that crosses state lines. So the revenues that the companies earn from those services, then there's an assessment. They pay that into a fund, and that pot of money is then divided up among different types of providers who provide critical internet and telephone services in rural areas.
Mm-hmm.
There's an organization that took the FCC to court, and they claimed that the system of collecting and distributing these funds is unconstitutional. So we can dig into the legal arguments, but the case eventually made its way to the Supreme Court, and the Supreme Court heard arguments at the end of March, and we expect a decision in July. NTCA participated actively in the case, along with other industry organizations.
To maintain that fund, continue to maintain that fund. Mm-hmm.
Certainly to maintain the program.
Mm-hmm.
And we'll have to see what the Supreme Court does. But you raised an excellent point, and it's one that the justices noticed also. Among the many things that the court needs to consider, there's a theory that they call consequentialism.
Mm-hmm.
So what happens if this fund goes away? We've presented and we've surveyed our members the number of investments that would be canceled. $850 million in rural broadband investments would be canceled in 2026, and $730 million would be anticipated to be canceled in 2027. We talked about the high cost of providing networks and broadband services in rural areas.
Mm-hmm.
And these small companies are able to do that based on universal service funding, based on loans from the Department of Agriculture, based on assembling private capital. But many, many companies said that if this funding goes away, the USDA loans and those programs, I think the highest default rate in those programs was about 15 years ago. It was like 1.26%. The loans have an ironclad repayment record among the small companies.
Mm-hmm.
But we had over 60% of respondents said they would have serious difficulties in making payments on those USDA loans.
And so we connect more dots here on this show as we do. We connect the dots between quality of life and policy, the implications for hospitals, for schools, for commerce, for households. It goes on and on and on. So we'll be watching that. And certainly, from where I sit, this is something that we should all be paying attention to. Again, we take it for granted, but this is all things that are happening, when we're sleeping. People are making these decisions about whether or not we're going to have connectivity. All right, let's maybe kind of move on to some positive news, because I've been following you guys for quite some time, and I know that you have a great program through your foundation for rural service called the Virtual Living Rooms. And again, we're talking about meeting the unmet needs of so many of our rural populations. And correct me if I'm wrong, this one is to serve our veterans?
Yes.
Okay, talk about that.
Department of Veterans Affairs has an outstanding telehealth network. And it's not just the sort of telehealth network that contemplates video calls with your doctor. They have a team that is really taking a look at the use of virtual reality platforms for telehealth. But they have an outstanding network for telehealth and to reach veterans and to provide medical services to them. What we found was that a lot of the older veterans who had not really used internet or broadband during their working years were not very familiar with the technology and may or may not have had those connections at home. So the virtual living room replicates your personal living room at home. And they're in fire stations, they are in libraries. The rooms are deliberately furnished, not like a sterile office environment, but much the way you'd walk into at your home. And our member companies provide broadband connectivity. They provide the equipment. There are usually people on hand to help veterans navigate the technology.
Mm-hmm.
And it enables veterans to access the VA's telehealth and other online services as well.
And these are really just lifeline programs. And on the other side of that, I did read a blog that you wrote about mental health with youth. Because again, we're talking about in rural communities, we have no shortage of mental health care deserts. Period. Right. End of sentence. A lot of schools are working on trying to come up with programs, and I've interviewed several folks on this front to make sure that there's telehealth for students, for behavioral health, and so forth. But you wrote a blog about the use of AI in mental health, and I know this is a conversation that we're having as a nation about the use of AI and its appropriateness and the danger zones and so forth. Can you give us a little bit of a summary of what your findings were from your own research and trying out the technology yourself?
Sure. So we always have to, I think it's important to think of AI as a tool and not a substitute. So, and we say this all the time, whether it's even just in standard telehealth practice, that telehealth is a tool in the toolbox, but it's not a substitute for in-person encounters, in-person therapy. Having said that, if you're in a shortage area, it can be a remarkable resource. And what the AI platforms for mental health therapy are doing, it is a communications platform, very often text-based, which is a modality or a medium with which many teens are familiar.
Mm-hmm.
And the AI engine is not providing counseling or therapy to the teen user. What it is doing, it is reading, it is triaging, it is summarizing, and then it is passing off critical information to a human caregiver. And human caregivers then can access the information more quickly, more critical needs rise to the top of the platform through a triage, and then they can respond. Sometimes the AI can actually craft a draft response that the therapist can then tweak. If necessary, the therapist can initially, ask, would you like to speak in person over the phone, or would you prefer to text? But that's really the platform. It just accelerates and expands the opportunity for involvement and access.
And, it's promising in so many ways. And if we circle back to the very beginning of this conversation, at the end of the day, telehealth, patients being able to, plug in and report whatever their glucose or whatever their blood pressure, all of these things are hospital electronic health records. They all require connectivity, and not just any. It requires a certain speed. I'm not a tech geek, but I understand, I was reading in the story, that, just there are some hospitals and other institutions that just are not even meeting modern day standards for connectivity and broadband speed. So before we close out this conversation, as someone who's got your eyes right there on what's happening at the federal policy level, let's talk a little bit about your recommendations. I know that your members also are provided with advocacy tools as well. Let's talk about advocacy efforts that create policy that does allow for broadband equity. I'm going to say the word. It will never leave my vocabulary, because what we are talking about here is truly making sure that millions of Americans across this country have access to broadband for a variety of reasons. So what are some of your recommendations for us to come alongside you and help to advocate for that which is of benefit for our rural communities, which is broadband? Just basic, what most people say is should be a utility these days. How can we make sure that is protected at a federal and state? And what can local officials do to help advocate for their communities as well? It's got to be a bit more voices than one, right?
Right. So I think the primary word is to engage,
mm-hmm.
and to speak with your local policy members, to visit with your congressional delegations, to find partners. And so it's an entire community rising to make the case. One resource that I would point people toward is NTCA's Smart Rural Community program. And it's a very, very easy URL. It is ntca.org/smart.
Okay. We'll put that in our show notes, everybody.
Okay. And scroll down to resources. This is a program. We have produced a number of research papers. They are not advocacy pieces. They do not argue for except for the fact that we all want more broadband, but they don't argue for any particular policy one way or the other. What they do is they present the facts. They offer the documented, data-driven academic evidence of better patient outcomes through telehealth and reduced healthcare costs through telehealth, how broadband can support workforce training and educational development for K through 12 students and beyond, the role of broadband in farming and how it can reduce the cost of inputs and create greater yields and reduce incidences of help farmers battle crop or animal disease. Those are the numbers. And then we pair that with on-the-ground examples, what we have seen in our NTCA member communities where close to 90% of the locations are served by fiber. And that approach, I call it numbers and narrative. I think that can make a sticky story for policymakers. And if you're in a community that has broadband, you get to tell the policymaker, this is what we have and we will continue to build on it. And we risk losing it if these programs go away. And if you're in a community that doesn't have it, it helps make the case, look what's possible with this technology.
Yeah, we talk so much about rural thriving, and broadband should not be the thing that barely helps us survive. I mean, this is what we need to thrive. So my goodness, Josh, I do appreciate you spending some time with us. Again, this is a really important, multifaceted, complex issue. And there's a lot of legislation and policy and a lot of moving parts right now. So we appreciate you keeping in touch with us. Anything that you think we need to know in the future, you are welcome back to talk with us anytime.
Thank you very much. I appreciate the opportunity to visit with you today.
Well, it's my pleasure. All right, everyone, stay tuned. I'll be back with a closing message. We'll be right back on The Rural Impact. Well, my thanks goes out to Josh, Caresse, and Sarah Jane. I'm so grateful for their time. And I always say these are not light subjects, but we do hope that you've been enlightened. And as a reminder, you will find the links from these conversations on our website, theruralimpact.com. Really easy to find us, including Dead Zone series links, as well as that which Josh mentioned to us about smart community tools. So again, we'll make sure that you can find those on our show notes and resources. Before we close out today on this subject, I do want to share with you, it's kind of ironic, moments after my conversation ended with Josh yesterday, my internet went out for 6 hours. I felt like a caged animal when it happened. I thought truly that it was a sign from the universe to really reinforce how important connectivity is to function. And then it made me think about what my life would be like without having connectivity. What would it be like if I lived in a dead zone? So maybe you can think about that. What would your daily life be like without access to internet or phone service? How might it change the quality of your life and your ability to access care, as but one example? Now, as you heard today, and as you'll learn when you watch and read the Dead Zone series, there are far too many people in communities that don't have to imagine not having connectivity because it's their reality. And here's another reality. Eliminating funding for digital equity will deepen the divide and worsen health outcomes for rural Americans. There is absolutely no way that is not the path that we're headed down should this happen. And what I'm talking about is that you heard me reference in my conversation with Josh that President Donald Trump has called for the Bipartisan Digital Equity Act. He's called it a woke handout based on race. And that's a quote directly from the president, woke handouts based on race. However, as we know, if you read the act, it hardly mentions race at all. In fact, the 8 covered populations that are included in this act are older Americans, veterans, people with disabilities, anyone anyone living in rural areas and members of, and again, this is directly from the Act, of a racial or ethnic minority group. That is 80% of the country that fits one of those groups. And most of these states where the Digital Equity Act is providing funding, has provided funding that was already allocated, most of those states have the largest rural population. So something to keep in mind. If you have a story about how funding for broadband equity has impacted your community in a positive way or negative, we want to hear from you. So we encourage you to reach out to us and share, and you can find us again at theruralimpact.com. We always appreciate it when you leave your comments. We love it when you subscribe so that you can get our post-series e-blasts. We send those out about every 6 weeks or so. And I just also want to mention to you, look for me on the road next month because I'll be recording from 2 locations in Nebraska. And I invite you to send us a note if you'd like to bring the show to our show on the road to your location. We really do enjoy having opportunities to meet you where you are. All right, my quick thanks to Sarah Staub and Brea Corsaro for all their hard work on this podcast. In the meantime, until we meet again, I invite you to take the best care that you can of yourself and, to the best of your ability, everyone around you. Okay, we'll see you soon on a new episode of The Rural Impact.